Medicare can be a complicated topic. Franklin Medical Center is here to help. This video is meant to provide education to our community about different topics relating to Medicare, especially the difference between Medicare and Medicare Advantage programs. First, let's talk about what Medicare is. Medicare is a government program to provide health coverage for people who are over the age of 65 or who are classified as having certain disabilities. There are different divisions of Medicare. Original Medicare, also called Traditional Medicare, or Red, White, and Blue Medicare, includes the following. Medicare Part A is the portion of Medicare that pays for inpatient hospital stays and treatments. Medicare Part B is the section that pays for outpatient needs, such as office visits, lab tests, imaging, and so forth. Next, there is Medicare Part D, which is the Medicare prescription drug benefit that pays for medications. If you have Original Medicare, you will typically have to enroll in a separate drug coverage plan. Then, there is Medicare Part C, which is what many people will call Medicare Advantage. Medicare Advantage is a program allowing the government to contract with outside organizations, often an insurance company, to offer a variety of different health plan coverage options for beneficiaries. This is what you often see on television commercials or in direct mail advertisements for insurance companies who are offering their own Medicare plans for senior citizens. Medicare Advantage plans feature a bundle of benefits that cover Part A, Part B, and sometimes Part D benefits depending on what is being offered. Now, let's go over the differences between Original Medicare and Medicare Advantage. Original Medicare will cover you for inpatient and outpatient claims. If you require drug coverage, you will need to sign up for a separate drug coverage plan. With Original Medicare, you are able to buy supplemental coverage to pay for your out-of-pocket costs. This is sometimes referred to as Medigap coverage. You can use any doctor or hospital that takes Medicare, anywhere in the U.S. In most cases you don't need a referral to see a specialist. On the other hand, with Medicare Advantage, you'll need to use doctors who are in that particular plan's network. You may need to get a referral to see a specialist. Be sure to ask your current doctors if they participate in any Medicare Advantage plans and make sure you do your research to determine if specialists or other providers such as hospice, nursing homes, or home health agencies in your area are in network as well, just in case you might need them at a later time. Medicare Advantage also offers a bundle of Part A, Part B, and usually Part D benefits. Medicare Advantage plans may also offer other benefits that are not covered by Original Medicare, such as vision coverage. Are there differences in costs? For Original Medicare outpatient services Part B, you usually pay 20% of the Medicare-approved amount after you meet your deductible. Out-of-pocket costs for Medicare Advantage plans will vary but can be lower depending upon the service in question and the terms of your plan. For Original Medicare, there's no yearly limit on what you pay out of pocket unless you have supplemental coverage. Medicare Advantage plans have a yearly limit on what you pay out of pocket for Medicare Part A and B services and can offer lower out-of-pocket costs for certain services. Original Medicare allows you to get supplemental or Medigap coverage to help pay your remaining out-of-pocket costs, or you can use coverage from a former employer or union, or even Medicaid, which comes at no cost. You cannot have supplemental coverage if you are enrolled in a Medicare Advantage plan. If you travel extensively, Original Medicare will typically not cover health care claims from outside of the U.S. However, you may buy a supplemental Medigap policy that does provide this kind of coverage. Medicare Advantage plans also generally don't cover care outside the U.S. Also, plans usually don't cover non-emergency care you get outside of your plan's specific network. As mentioned previously, you cannot have supplemental coverage if you are enrolled in a Medicare Advantage plan. Finally, and most importantly, there can be certain coverage restrictions associated with Medicare Advantage plans. With Original Medicare, in most cases, you don't have to get a service approved ahead of time for it to be covered. In the case of Medicare Advantage plans, you often must have a service approved ahead of time for it to be covered by the plan. This is called a request for prior authorization. You might also find that the Medicare Advantage plan disagrees with your doctor or other provider's order for you to receive a specific treatment. If the plan denies coverage of the treatment because it does not consider the treatment to be medically necessary, there can be a lengthy appeals process with no guarantee that your doctor's preferred treatment for you will ever be granted. These are just some of the factors to consider when choosing between Original Medicare and Medicare Advantage. Make sure you understand the differences. Ask your doctor and other health care providers to be sure they are in the correct network for any Medicare Advantage plan. Take your own health condition into account. Are you someone who might need a high degree of specialist care? Are you likely to need home health or rehab services? These are all items to be considered. Lastly, be cautious of sales pitches. Not all plans are the same, and there is a wide spectrum of services, costs, and benefits to keep in mind. We hope that this has been helpful. Thank you for your time. Should you have any other questions, please feel free to call Franklin Medical Center at 318-412-5265.